right here on KTV2, the family channel. And our second guest right here in the studio, we have with us Dr. Talal Ashour. And Dr. Talal is a diabetologist at Amiri Hospital and Dasman Diabetes Institute. Dr. Talal, welcome to the Weekend Show.
Thank you very much, Tarek, for hosting me for this lovely show, and I hope I'll be able to answer all of your questions.
Well, nice to have you with us, Dr. Talal. And November is Diabetes Awareness Month with November 14th as World Diabetes Day. So how prevalent is diabetes in the state of Kuwait, and how is it ranked worldwide in terms of the number of cases, please?
So, Tarek, let me tell you something. I'm not really very proud of our prevalence worldwide in terms of prevalence of diabetes. Kuwait is actually in the 6th place, and we have around 23 to 24% of our population have diabetes. So you could imagine that out of 4, there is actually 1 who knows he has diabetes. He or she knows that he has diabetes. But this is actually not the actual figure, because if we look and dig deep, we might actually find that the prevalence is actually higher than the actual number that we really have now.
So, Dr. Talal, that leads me to my next question. Why is it at such a high number right here in the state of Kuwait?
So, you know that Kuwait, in terms of prevalence of obesity, is considered as number 1. So, obesity constitutes a major factor for developing diabetes, especially type 2. So, the sedentary lifestyle, meaning we like the activity, we like the exercise. The other thing is the type of food we really eat. So there is bad habits in terms of eating fast food that really convey or leads eventually to the development of type 2 diabetes.
So unfortunately, Dr. Talal, we're high in the rankings for things that are not too good, obesity and diabetes. I mean, are there any other causes of diabetes that you'd like to share with our audience, please?
So even, you know, like we have a say here in Kuwait that if you're not diabetic, then you are not Kuwaiti.
Yes, that's true.
So genetic really plays a big factor in the development of diabetes. And if you have a family history of diabetes, then your likelihood of developing diabetes type 2 is much higher than those who doesn't have really history of diabetes. One major factor that really contributes to the development of type 2 diabetes, which we really see it more often in females, is the development of gestational diabetes, which I mean development of diabetes during pregnancy. We have a very high number of pregnant ladies who has diabetes.
So that's on the increase also?
That's on the increase.
And why is that, Dr. Talal?
It's all related to the weight.
Okay.
Because, you know, we have an overweight population, and we don't really have the exact figure of how many or the prevalence of the gestational diabetes, but we know that we have a very big number of diabetic women or gestational diabetes. The thing is that if someone developed gestational diabetes, which is diabetes during pregnancy, their chance of developing type 2 diabetes in the next 10 years is between 50 and 60%.
Okay, now for our audience who may not be familiar, you've mentioned now type 2, and I think you touched on type 1. What is the difference now for our audience, type 1, type 2? Tell us about that, please.
So type 1 constitutes around 5% of the total number of diabetic patients. And the exact mechanism, we really don't know why they develop type 1 diabetes, but we know that there is an autoimmune destruction of the beta cell which are responsible for the secretion of the insulin. And we don't know why. Some people say it's maybe related to the bottle feeding, it may be related to the exposure to viral infection during childhood. But then type 2, and their treatment is actually only insulin at the timing. We don't have any other modality of treatment.
That's for type 1.
Well, this is for type 1. While the type 2, which constitute around 90 to 95% in terms
the majority
of the
population,
people, is in which there is an insulin resistance, meaning that people really have insulin, but there is a resistance to the action of the insulin. And the major factor is actually obesity also.
Okay. Now that's type 1 and type 2, and you also touched on gestational.
And there is gestational diabetes. You know, the word diabetes is a very big terminology, but if you look into the subdivision, there are actually many types of diabetes, but the ones we really talk more often about is type 1, type 2, and gestational diabetes.
And our audience also would like to know, you're an expert in this field, Dr. Talal, a diabetologist with years of experience studying in Canada, practicing in Canada, and also here in the state of Kuwait. And now, what treatments are available for diabetes, type 1 and 2. You mentioned type 1 earlier, that really nothing except the insulin shots. But anything new on the way that you could share with the audience, because a lot of them are so, tired of all these pricking that they must do, the needles, injections. Share with us anything new and the current treatment.
Sure. So for type 1, beside the insulin injection, there is, of course, the insulin pumps, which I think at one point, Dasman Diabetes Institute took the initiative
for that,
to start and make sure that the insulin pump goes to as much as possible of type 1 diabetes. It's a very good modalities of treatment for type 1, especially for type 1. But it really needs that the patient should be aware of what we call carbohydrate counting. They need to know how to calculate their food. And of course, they need to test their blood sugars. In terms of type 2 diabetes, I mean, we have so many groups of medication that diabetes is not only insulin resistant. I mean, there are about possible 6 or 7 mechanisms, pathophysiology of what causes type 2 diabetes. And each one of those groups tries to tackle one part of this, one of those mechanisms. I mean, there has been a talk about, which still is under investigation, still under research protocols, not really implemented as part of the treatment of type 2 or type 1, is the stem cell transplant, or whether it's a whole organ transplant. I mean, a whole organ transplant, we have good studies in terms of type 1 diabetes, but stem cell transplant, unfortunately, we don't have enough data. And I just would like to warn the audience about, those advertising that comes from...
Yeah, there's a lot of that. They see different advertisements online, newspapers, so forth, saying, come visit, we can cure you from diabetes. Is this true?
They have to be very careful. If you look at the FDA, they really did not approve this as part of diabetes treatment. They only say that if you want to do, let's say, a stem cell transplant, they will take their own risk to try this treatment, and there is nothing guaranteed with this treatment yet at the time being. It's still under investigation, still under research protocols, nothing yet implemented as part of the treatment.
And now, moving on with some of the other questions that we have for you, Dr. Talal. Now, diabetes, if people just let it go and it gets out of hand, can it be fatal?
Diabetes definitely can be fatal, meaning like if you think of the commonest cause of blindness is diabetes. The commonest cause of leg amputation is diabetes. The commonest cause of renal failure is diabetes. Diabetes is responsible for every complication exists in this world. So diabetes is actually responsible for the majority of the disease. If you have a poorly controlled diabetes, you are at risk of developing blindness. I have this story about a young lady who's 30 years of age. She was not really taking care of her diabetes very well. So what happened that she had a retinal detachment, that she lost vision in one eye, and then she had a major bleed in the left eye, and then she became blind. So you could imagine that someone who the society would expect her to give is actually vice versa, meaning that the society has to take care of her at a younger age, meaning that they spend the money on trying to make sure that she doesn't develop any diabetes complication. But yes, if you have a poorly controlled diabetes, yes, devastating, fatal outcome could happen.
I always hear, Dr. Talal, that exercise is very important if you have diabetes, and even if you don't. I mean, we just talked about at the top of our interview, obesity, diabetes, hand in hand, they're going together. Today, Dr. Talal, there was a big walkathon, the annual Beat Diabetes walkathon. Exercise is really important for people with diabetes. Elaborate more on that.
Definitely, definitely. It's a very important part of our treatment in terms of type 1 or type 2 diabetes. What happened with exercise is actually improve insulin resistance, and the patient become more insulin sensitive to the treatment. All the major
Sorry, doctor, as we're taking a look at the monitor, some of the pictures from the walkathon today, a very beautiful event. So many people came out, Dr. Talal.
Yeah, I would really like to thank Dr. Kardan Bahbahani, because the
director
of the Dasman Diabetes Institute, which made this happen. It's becoming a very attractive, popular event every year, which is taken, and you could see, mashallah, there is almost
the color of blue everywhere.
Just blue.
It's
and
beautiful.
There are more than around 5,000 people were there. And I think we have to keep an eye on diabetes, and those are the kind of events we're actually looking for, just to make people aware that actually diabetes is there, and they have to be more aware. They have to understand more about the risk of diabetes and the complication of diabetes. And yes, we advise people, according to the American Diabetes Association, according to the American Association of Clinical Endocrinology, whether it's UK diabetes, all of them advise for exercise on a daily basis, and they mention moderate exercise. You don't really need to do any heavy lifting, or, moderate exercise means walking. What you really need to do is walk for half an hour daily, 5 days a week, total of 150 minutes, which is reasonable for any diabetic patient.
Yeah, you always have people saying, we don't have time, our schedules are busy, but you can make your time for this. It's essential, doctor.
Absolutely. I mean, like, rather than watching a series or a movie while sitting in the couch, they can actually use a treadmill and see the same movie and losing more calories.
Very well said. And coming up this Thursday, Dr. Talal, November 21st, Dasman Diabetes Institute is having a huge event, their big open day that they have every year in celebration of Diabetes Awareness Month. And what are some of the activities that Dasman Diabetes Institute will be having for this big celebration this next Thursday, November 21st?
Sure. Let me elaborate about this thing. I mean, it's very important to communicate and to go and talk to the people, to let them understand more about diabetes. And those are some of the activities we really advise all organizations, all hospitals to participate in. So Dasman, on that day, they're going to be checking blood sugar, they're going to be giving expert opinions regarding their diabetes management. I think there is cooking sessions, they're going to have face painting, they're going to talk...
Some nice activities for the whole family,
yes,
the kids
so
too.
Some nice activities, and that's not all. Even cooking sessions, ideal cooking session for diabetic patient, and how they should cook their food and what kind of food they should eat.
Yeah, I'm looking forward. That's a big event, November 21st, this next Thursday, from 4 till 9 p.m. All those activities that you just said. And Dr. Talal, at the end of our interview, do you have any last comments for the audience watching the weekend show tonight?
So first of all, I would like to thank you for hosting me in this lovely show. I just want to tell them, please keep an eye, if you're diabetic, keep an eye on your diabetes. Don't let it pass easily. Just keep and make sure that you do the proper blood tests, you take your medication as regular, and of course exercise, which is very important in the treatment of our diabetic patients.
Dr. Talal Ashour, thank you so much for joining us. I know you have a very busy schedule. We appreciate your time with us.
Thank you very much.
Thank you so much. We were speaking to Dr. Talal Ashour, who is a diabetologist at Amiri Hospital and Dasman Diabetes Institute. We'd like to thank him so much for his time with us right here on the program.